Hello, Colombia. My name is Dr. Jolle Kirpensteijn. I'm the Chief Veterinary Officer, Hill's Pet Nutrition. I'm very delighted to be in your beautiful country. And I work for Hill's Pet Nutrition. I'm their Chief Vet. And so I have the responsibility globally to promote our products, to support the profession, and also to really have the voice of the profession within the company. I started really young that I wanted to do something else next to my student career in veterinary medicine, and I studied in Utrecht University. And one of my professors told me to go abroad, and I wanted to go to the US, so I applied for some internships there, or externships at that time, and they invited me to come to the US. And I was a student there and I had a great time. And then I went back to Holland. And then I decided, okay, what I want to do with my career further. And I decided I wanted to do a internship and a residency in surgery. So I applied for the University of Georgia. I was an intern there. Then I became a resident at Kansas State University. And then I decided that I was really interested in tumor surgery. So I applied for a position as a fellow at Colorado State University, where I did my oncology fellowship and did my boards. And then I became an oncologic surgeon. My specialties are oncology, endoscopic surgery, and reconstruction. So any of these three things really make my heart beat a little faster. So if you're interested in that, first what I would do is read about it. So get some literature, see if this is really a topic that interests you. If it still does interest you, then I would say take the next step and go somewhere where they have either laboratories or have practical things that you can practice. And there's lots of ways to increase your practical skills. And if you still like it then and you want to specialize it in there, then you can think about maybe doing a specialization. Sometimes that's possible during an internship, sometimes you can do a residency, or you can do a master's degree, or even a PhD in oncology itself. And then a lot of the universities will offer specializations or at least tracks where you can do oncologic surgery. So there's multiple ways that you can do it. I myself started first doing my interest. So I did a couple of externships that I really liked. Then I started to do my internship and residency. Then I did research in oncology too. So there's so many different aspects of oncology that you could pursue when you're a veterinarian. If you're in a practice and it's really busy, what you also can do is specialize yourself. So, the more you do things in surgery, the more experience you get and the better you get at it. So if you really start focusing on one topic, in this case, tumor surgery, you'll get better in time, and then, at a certain point, you specialize yourself. We need to talk about oncology in general. So we know that our pets will get tumors quite often. We know in dogs, it's around 50%, around 10 years, and in cats, it's a little less than 50%, but they get tumors very, very often. And we also know that surgery is probably the best way to treat most of the tumors. Not all of them, but most of them. And when you're really early, that's when you can do, as a matter of fact, your best job. So when the tumor is still small, we can remove them, and we can prevent a lot of diseases associated with tumors, like metastasis or regrowth. But it's really, really important. So oncologic surgery is an essential part of the whole plethora of treatments that we have for tumors. I'm not saying that chemotherapy is not important. It is also. Radiation therapy can be a part of it. But, at the basis, there is tumor surgery. So you have to recognize the disease. So very often our clients, our consumers, do not know how important it is that we can treat tumors. When they hear cancer or tumor disease, they often think this is the end, that there's nothing that we can do. But we, as veterinarians, as Murphy, can do a lot. The second thing is for us to recognize the tumors. So we need to do a good history, we need to do a good clinical exam, and then we need to do good diagnostics. And diagnostics could be a fine needle aspirate biopsy, or radiographs of the chest, or a real biopsy, or sometimes an ultrasound of the abdomen. So you need to work these cases up really, really well. So you know what kind of tumor you're dealing with. And as soon as you know that, then you also know what the best treatment is. And you can't do it alone. So sometimes you have to reach out to colleagues that are in your practice that have knowledge about other things, or you can reach out to other specialists all over the world or in your country, wherever it is. But oncology is a really tough disease because it affects a lot of organ systems. So it's not just simple surgery. It could be that you need to have internal medicine knowledge. It might have to be that you need to have knowledge of medication and therapeutics. It might that you need to take radiographs or CT scans. So there's a plethora of specialties that are all involved with oncology. And you have oncologists that give chemotherapy. You have radiation specialists sometimes in your area. So there's a lot of different specialties. And if you look at human medicine, very often they treat their patients in a multidisciplinary system. So they have multiple experts looking at the same case and then together come to a consensus about what the best treatment is. That's not always available in your own practice if you have a small practice, but you can always call your colleagues for a second opinion if you don't know exactly how to treat certain cases. Consumers come to me with their pets. They're very distraught. They don't know what to do. They've sometimes read the internet, so they went to Dr. Google and asked some questions, but they're often very, very confused. So as veterinarians, it's really, really important to give the facts clearly. And I think a clear explanation of what kind of tumor it is, what you can do for the pet, what you can do for the owner, what the options of treatment are, what the options of diagnosis are, how much it's going to cost, and how long it will take. And then at the end, explain a little bit what the results could be. What is the prognosis of the disease? Sometimes, owners are so distraught that they don't hear what you're saying. And sometimes we have to go back. So often after I've had the consult, the owners went home, I call them up and ask them if they understand what I talk to them about. Sometimes I'll give them flyers with a short explanation, but I always call them back to see if they understood what I've said. And then I also always give them some time to think about things. So don't make rash decisions. There's lots of options that you can take, and owners really appreciate it. So I would say, to summarize, be very clear, follow up, and then also give them the options that they need. Then I have to confess something. When I was a surgeon, I didn't think that much about nutrition. However, in oncology, we know that pets lose weight a lot because of the tumor disease that they have, and they need this extra support. They need this extra care, and often they need a higher density diet. And this is exactly what ONC Care does. So it is a supportive diet for pets with cancer. And I wish that in my time, when I was still active in practice, I had a diet, because what I can tell you is that owners ask me that all the time. They always ask this question. So what is the best diet for my pet right now when it has cancer and afterwards? And I couldn't give them an answer because there was no answer. There was no solution. So you had to make up some things. But now we have a diet that is perfect for pets with cancer, that is supporting these pets, giving them a better life. And so I'm really happy with this solution. So I'm very proud of my company that they came up with this. There's a lot of research that went into this diet, 5-6 years of research. So thank you for this interview. And one thing I would like to do is thank all you veterinarians and veterinary technicians in Colombia for the hard work that you do. I know that your number one goal is to make pets feel better, treat pets that are sick, and also treat their owners to feel better about their pets. So you do a great job, and I'm always appreciative of being in this beautiful country. And I really, really want to thank you from the deepest bottom of my heart for all the good work that you do.
Pet industry.